Schizophrenia is a chronic brain disorder. It can affect individuals' behavior, feelings, and their thinking. And at times it can be progressive, it's lifelong, and contrary to the general belief, it's not a multiple personality or split personality. It's a brain disorder that affects people's functioning in society. About 1% of US population suffers from schizophrenia. It's equal in prevalence in women and men. Generally, men begin to manifest the symptoms and get diagnosed earlier than the woman. There is only one way to diagnose schizophrenia. It is through the personal interview, taking the patient's history, sometimes talking to their family, doing the mental status examination. There's no test available to really diagnose the schizophrenia. It's through the personal interview and the mental status examination. That's how you establish the diagnosis of schizophrenia. Some of the symptoms of schizophrenia include delusions, the false belief system, the hallucinations, disorganized thinking, general social withdrawal, and lack of motivation. Those are some of the symptoms of schizophrenia. Lately, we have begun to separate them into positive and negative symptoms of schizophrenia. The positive being the delusions and the hallucinations and the disorganized thinking, and the negative symptom generally having a lack of motivation, the flat effect, lack of social engagement. We really don't know what causes schizophrenia. The general consensus is that it's probably the interplay between the nature and nurture. It's the genetics, the brain chemistry, the environment, the stressors, the upbringing, all the people, all those factors mixed together to probably cause schizophrenia. Unfortunately, we don't have a cure for the illness of schizophrenia. We can treat the symptoms, manage the behavior, manage the symptoms, but we cannot cure it. Generally, it requires a lifelong treatment, and it entails the use of antipsychotic medications and talk therapy, and of course involving the family and the community to provide the resources where you can have a team of players helping to manage the schizophrenia. Schizophrenia itself doesn't kill you, but some of the illnesses, some of the medical problems that go along with the illness of schizophrenia, and they're more common in schizophrenia, can lead to early mortality in schizophrenic population. And of course, the rate of suicide in schizophrenic patients is higher than the general population.